Yes, it's a Saturday, and you know, say when it be Saturday officially, na Health Matta na we dey take discuss because we know say papa, mama, children, everybody go dey house, and as dem dey house, health na wetin cut across all these people wey we don mention because both rich and poor, everybody need good health to be stay alive. So therefore, so time don reach wey we go dey discuss health with person wey sabi certified doctor. Yes, I dey talk about ogbonge doctor wey don dey do am with us years back. I'm talking about no other person but Dr. Barth. Good morning, sir.
Good morning.
Dr. Barth Ufoegbunam.
Thank you very much, Chief.
How you doing, sir?
So happy to be back with you this morning.
Slimy, good morning.
Hey, Chief.
Good morning,
Doctor.
You're looking sporty today.
Yeah, thank you. Good morning,
thank
sir.
you.
You look good yourself. I told you I'll collect your shirt when you're good.
Thank you very much. I appreciate it.
Okay, good to have you.
Good morning, viewers at home and around the world. This morning we'll be looking at the topic we started a fortnight ago, talking about no other topic than measles.
Measles.
As we speak, I can tell you that the epidemic is spiking globally. As of last week, we said about 971 cases were found in the US. As we speak, in the last couple of days, it has gone up to 1,001 cases. 1,001 cases. Now, this is the highest they've seen since the year 1992. Okay, but this morning we'll look at WHO fact sheet, okay, on some of the things we need to know about measles. Okay, but for viewers who may be joining us for the first time, what is this measles? Okay, that we'll be hearing about for years now, for decades, even for centuries. Measles is a highly contagious viral infection that is usually very deadly in children as well as adults, predominantly in children. Suffice to say that this measles too is a vaccine preventable disease. All we need to do to escape from what we are talking about is to make sure that our children are vaccinated as at when due. We'll hear more about vaccination in measles in the course of in the course of the presentation. How does it present? We want to do a recap from what we said some 2 weeks ago. Measles initially will present with flu-like symptoms, if you like. It presents with fever. That's before the eruption of the rash. It presents with fever. They usually talk about 3 C's. Apart from fever, it presents with cough, hacking cough. It presents with coryza, that's catarrh, runny nose. It also presents with conjunctivitis. Yes. And so you usually will see children with watery reddish eyes. Okay. Now, these symptoms could actually appear 3 to 4 days before the appearance of the rash. And the rash, as we said before, is usually very characteristic in that it starts from the hairline through the face and moves down to the trunk, upper trunk, lower trunk, as well as the extremities, talking about the hands and legs. If it is not treated, it can actually develop into a number of complications that can actually cause death if such people who are affected are not properly attended to. It's been said that 1 out of every 4 people infected with measles will actually end up being admitted in the hospital. Suffice to also say that oftentimes it's an illness that mothers, that fathers can actually treat at home. Okay? It is a viral infection. Just like a number of viral infections, sometimes it runs its course and it goes.
If I hear you, sorry to cut you, sir. If I hear you very well, I beg your pardon. You say now illness where mama and papa feel cure by themselves for house.
In our environment, we do know that it's not all the time that people who have fevers, who have measles, are actually brought to the hospital.
Yeah, sure.
We know you don't even bring them.
Yes, there are a number of local remedies that often
they
use.
That white this thing where you go, you like the color.
Oftentimes they know, even the calamine lotion to stop the itching. In some people who may have itching, you're usually prominent in measles, but you have itching more in chicken pox. Okay, so talking about the complications that they could have, children who have measles could come down with complications like diarrhea. pneumonia. Okay, in rare cases, they could also come down with encephalitis,
Meaning?
What does that mean?
swelling that affects the brain tissue.
Because I was about to ask that a doctor friend of mine actually said measles could lead to brain damage.
Yes.
About blindness.
Yeah, it can cause deafness, it can cause blindness. Of course, anything that can affect the brain can actually, depending on part of the brain that is affected, it can actually affect a number of functions in the body. You know, usually the way our brain is patterned or structured, every part of the brain controls a certain areas of the body. That is why you see some people who have stroke, a part of the brain is affected. Because a part of the brain is affected, there will be loss of movement or vision on one part of the body. So depending on part of the brain that is affected, but it can actually cause deafness, it can cause blindness, okay, when not treated. Okay, now, let's look at some of the facts sheets that we have from WHO.
Okay.
Measles, before now, was causing in the neighborhood of 2.6 million deaths. That's prior to the discovery of measles vaccine, which of course started in the year 1963. Between the year 2000 to 2017, the widespread use of vaccination for measles has actually brought about a decrease in the number of global deaths that we have for measles. 545,000 deaths in 2000 to 110,000 deaths globally in 2017. 85% of world children were said to have been vaccinated in the year 2017 alone. Suffice to say also that about 4 million Nigerian children who were meant to be vaccinated within their 1 year of age actually missed out in the vaccination. And that is why measles outbreak will keep thriving, not just in Nigeria, but globally. Almost every country of the world has been affected with these latest epidemics. And I can tell you how it started in the US, okay? It was actually some unvaccinated Jewish community members that traveled to Israel, at least so we read, that traveled to Israel where there was an outbreak. And of course, they picked it up and traveled back into the country. And from there onwards, other children who were unvaccinated, because as we speak, there are still a form of complacency globally concerning the use of vaccines generally. A lot of people have refused to avail themselves or their kids or their wards for such vaccination opportunities. And of course, that is why measles has kept on thriving. Okay. Now, if we can put in the degree of effort that we did at the time we had such challenges with smallpox, which of course has been eradicated.
Yes.
Yeah.
Should we use eradicated or curbed?
No.
Has been
There
eradicated,
are two
but there's
words
no
that we
case
usually
again.
use. You can either use eliminate.
Eliminate. Because
Okay,
to say
or
eradication.
eradicated. Eradicated means that
It is
has
no
been
longer, that's what I'm
completely
saying, completely eradicated.
eradicated, taken out of the world.
Because medically, you say we can't eradicate. That's why I just
No, you have elimination. There are actually terms, and you have elimination. For instance, America was said to have eliminated measles in the year 2000. Okay, what elimination means is that over a period of 12 months, the disease does not thrive there. People who are residing there won't be infected. That's the disease does not exist there. Okay, but if the current outbreak is not curtailed, they will soon lose that status of having eliminated measles. Not just America, a good number of other countries.
Even
in
Algeria
Europe.
now has no malaria.
I think the only thing
Algeria
that is coming
has
to my mind now
malaria
is the video you played for us the other
Okay, so
one.
but when we talk
The guy
about
said, yes,
never
never.
come to-
yes. But when we talk, I will still see the video shortly later in the day. So when we talk about eradication, it means it does not exist anywhere in the world whatsoever. But for that of smallpox, that has been eradicated since about 4 decades ago, more than 40 years ago, I understand that they are still being kept in 2 separate laboratories, in Russia and in the US. my sister.
For
you shouldn't
future
ask
proofs
me.
or what?
Maybe for further research
That's what I'm
purposes.
saying.
Okay, a friend of mine said, well, possible biological weapons, but I don't want to think along that line.
Well, you can't actually, we can't tell. Well, it's important we open the phone lines now. It's never too early. So that anybody where they watch us, we get question for Dr. Barth. Anything where you want to ask as far as health, tabi health matter, they related. So about the day you go, they answer any question where you carry come. But before we do that, it's important we go on this short break. We shall be right back. Go nowhere.
Health matter na serious matter o. That na why we dey always get Dr. Barth Ufoegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show wey dey help people. Terms and conditions apply sha o.
For advert placement and sponsorship, make una call Stella Maris on top 070 3914 5229. Rebecca 070 6969 1950.
Measles is one of the most contagious of all viruses. 90% of people who are exposed and not vaccinated will get it. The virus lives in the nose and throat. It's spread by breathing, coughing, sneezing, or coming in close personal contact. It can hang suspended in the air or on a surface for up to 2 hours, meaning you can catch it by just walking into a room. One person can infect as many as 18 others. The virus incubates for 7 to 14 days. Then the first sign of measles begins: high fever, cough, runny noses, and red and watery eyes. After several days, a rash erupts. Red flat spots appear on the face and then spread downward to the neck, body, arms, leg, and feet. An infected person is contagious from 4 days before to 4 days after the rash breaks out. Ear infections and diarrhea are common complications. More severe cases can lead to pneumonia or encephalitis, a swelling of the brain, which can cause permanent brain damage. 1 or 2 in every 1,000 children with measles will die. But measles is preventable with a vaccine that is 97% effective. Measles vaccination started in 1963 in the U.S., and the virus was declared eliminated in 2000. That means it no longer originates here. Still, there are about 20 million cases a year worldwide. That means an unvaccinated person can bring it into the country while traveling, which is how a current outbreak may have started at Disneyland. The U.S. has seen 102 cases in at least 14 states in January of this year alone, a rate that has health officials on high alert.
Yes, I hope you enjoyed that video where we just play now. Dr. Barth go draw more on top because it is very, very deep. What did that man talk?
That was in the year 2015. I must point that out. Okay, as a matter of fact, as we speak, U.S. has witnessed, as of 2 days ago, because as we speak, may have gone beyond that. U.S. have seen 1,001 cases of measles. Largely hit is a state like New York. Okay, in Africa too, a number of countries have been affected. Nigeria has been affected. Madagascar is said to be the worst hit in Africa, and equally in Europe. So the global epidemic is actually spiking all over the world. Okay, but what do we need to do to prevent and curtail this scourge? That is the essence of this program. What you need to do as a father, as a mother, is to listen very carefully to what you need to do now. Number one is you need to ensure that your children are all vaccinated. Especially children that are under 1 year of age. The recommendation from WHO says that we should ensure that every child gets at least a double vaccination for measles.
Okay.
In our environment, I can tell you that the one that is commonest here is one that usually children are given at the age of 9 months. Talking about single measles vaccine. Any child who has been able to get that at the age of 9 months will have about 93% immunity from picking up measles infection. Okay. Now, there's also another one that is not a single vaccine. It is called MMR, measles, mumps, and rubella, usually taken at 15 months of age, and then the second dose of it will be given when the child is between 4 to 6 years. It is important. Every hand must be on desk. You should not just ensure that your children alone are vaccinated. You should also want to care about the people living in your community. Ensure that everybody gets this information. The only way we can eradicate measles in Nigeria, or eliminate, let's start from elimination first. The only way we can eliminate measles in Nigeria, as well as all over the world, is to increase the population vaccination coverage, okay, otherwise known as herd immunity. Suffice also to point out that there are people who cannot get vaccinated. Children under the age of 9 months in our environment cannot get vaccinated. But abroad, I can tell you that children between the age of 6 months to 1 year do get vaccinated when they want to travel out of America. They usually get vaccinated with MMR. So for such children, they will eventually receive 3 doses. Now, it is possible for someone who has been immunized with measles for the first time to eventually get measles along the line. But usually the effects are lesser. But by the time you ensure that your child or your ward gets vaccinated, gets the first vaccine as well as the second one, okay, double vaccination, such a child will have about 97% immunity from picking up measles. Suffice to also say that there are 3 in every 1,000, 3 in every 100 who, despite being vaccinated twice, could still have measles. Okay, but I can tell you that with the increment in the vaccination coverage globally from 70% that it was in the year 2000 to 85% that it's currently that it was also in the year 2017, 21.1 million deaths have been prevented as a result of this vaccination. The vaccine is safe, is effective, and it doesn't come with any form of, yes, just like drugs, vaccines drugs sometimes could have minor side effects that may not be significant. That can also occur in vaccination, not just measles vaccine. A number of children, after getting vaccinated, you discover that they have fever. Those are the simple things that you can, which the child can surmount with or without therapy. So the measles infection has been thriving largely because of misinformation that is out there.
So sorry, sir, let me just pause you there on the issue of vaccination, because there is this general belief, and I want you to debunk, if possible, why most people they fear the vaccination or the vaccine. They say, I don't hear severally, they go talk, say if we collect that vaccine, say it get us, they suppress our reasoning ability. Some other people even talk, say that thing go limit the number of children wey person if he produce. And I know as they talk, some parents at home go they not and say, hey, not true, because we don't hear these things on the streets. That once you receive, you want to say something like
just to add to what he said, because I know there's an uncle of mine where we say one part of his leg, they use and walk well. I remembered me asking my mom, I say, Mommy, what's happened to this particular person? I was like, I say, na vaccine, na injection you collect, na in cost. So really, truly, because that's not the mindset where they get. And that's why I actually wanted to ask you of that woman where you talk, say she brought her child to your hospital, and then immediately she had you giving the child vaccine. She took the child away and said she didn't want vaccine for the child. So
she didn't
people
want
say
injection
rather. So now, so people still have that mindset. They are still living with that mindset. So really, are they true?
Thank you very much for those observations. And that's essentially what this program is all about, to debunk such claims, okay? Number one is that, let me start from the case you pointed. The person who got, who had an injection, and then we'll have Sarah from Niger. We'll come back to your question. Good morning, Sarah.
Sarah.
Yes.
Good morning.
Obviously, you are a nursing mother.
Yes, sir.
Good morning, Sarah.
Good morning.
How you doing? Doctor is here.
Okay. I said, what time will the measles usually come up for the children?
What time?
Do you mean the disease or the vaccine?
Which season?
Season.
Okay. Thank you very much.
Yes.
It actually doesn't have a season. It's not a seasonal disease, so to say. It depends on the outbreak that is going on in a particular community. Sometimes you could have sporadic cases here and there. Okay, for instance, people who who may be in the measles endemic region could actually travel and come into a population, okay, that does not have measles at that material time. Now, but like we always point out, the degree of vaccination, that's talking about the coverage, the immunization coverage in such an area will determine what will happen afterwards. I can tell you that for children who are under the age of 6 months, if they're living in a population where you have about 95% coverage of vaccination, the herd immunity in that environment can actually prevent those underage children who cannot be vaccinated. Okay. Not just underage children that cannot. There are other contraindications that can actually make one not to get vaccinated. We'll come to that shortly. Okay, but there doesn't seem to be any particular reason when this disease thrives. Number one is that it is a human disease. Yeah. It does not affect animals. So we can transport it from one point to the other. Okay, like the case that we have in the US, started to be some people that traveled to Israel where there was an epidemic and picked it up and then returned to New York and then started spreading it among a community that has a form of apathy or complacency towards vaccination. I'll tell you, one of the reasons why people are shying away from vaccination is the already debunked, scientifically debunked claim that there was an association between MMR vaccine and autism. Okay?
Sure.
Now, there is no such association. MMR does not cause autism. That has been proven beyond reasonable doubt. Now, coming back to the question that you asked, that somebody who got injected with vaccine and at the end of the day started limping, that can happen with virtually every injection. It's the method of administration. We have Musa from Gombe. Good morning, Musa.
Hello?
Yeah, good morning, Mr. Musa.
Measles, you say it's affecting persons, an adult person. In what age?
What age?
In what age?
Thank you very much, sir. Thank you very much, sir. Now, it affects children and it can affect adults, usually above the age of 20 and 30 years. So permit me to also point out that people who were born before 1957, usually they don't need to get vaccinated. Why is this so? At that time, the immunization has not come. Okay, so the measles was so common then that almost every child at that time
had it.
Okay, so that was when it was killing people in millions. So someone who has had suffered measles before will have a lifelong immunity. The person may not have it in his or her lifetime again. Okay, so those are the age group that we usually look at. Okay, now concerning the questions you also pointed out, that does it have anything to do with childbearing? That is what I understood it to mean. Yes. It does not. Vaccination does not
suppression
affect
of our reasoning faculty.
Yes, it does not cause mental retardation in any form. It does not also affect fertility in any form. Okay, so that's why we need to make sure that in 2017 alone, over 4 million Nigerian children missed measles vaccine within the first year of life. Now you can imagine if such a child gets infected with measles and probably comes into a community, because usually it's a community-based rejection that we are seeing all over the world. Talking about the Jewish community in the United States. Okay, so if a single pupil gets infected and brings the disease to the school, you can imagine the degree of, because one person that is infected with measles can actually infect as many as 90% of people that will come across such a person will pick up the disease. And the worst part of it is the fact that one can pick up the infection when the person is barely manifesting any symptoms, when you cannot even have a rash. We have Innocent from Calabar. Innocent, good morning.
Good morning, doctor.
Yeah.
Well, some children, you see them with big belly, small legs, small hand. Is it the same measles that causes it?
No, sir. No, sir. The picture you painted can be found in a number of medical conditions. Top on the list, Kwashiorkor. My e-doctor has answered, which is as a result of malnourishment in such children.
Okay.
Okay. Also, people who have sickle cell anemia,
Yeah.
children who have sickle cell anemia may have something that looks like the picture you painted. So that's not measles, sir. Thank you very much for your question.
Thank you, sir.
Okay.
Thank
You're
you.
Yeah, thank you. So talking about the vaccine, because the emphasis should be on vaccine, because this is a vaccine preventable illness.
Meaning say if person take the vaccine,
I see
tendency
you are
high, say
97%
Yes. Yes.
safe.
no go
Now,
gree.
because I was talking about how contagious this disease can be, and I said that at the beginning, when the person hasn't started, when an infected person does not have a rash, the disease can actually be infectious even prior to the eruption of rash in an infected person. Meaning that if any of us here is infected, as we are seated here, we may not even know.
Yes.
The rash will appear after some days,
days.
7 to
When
10
it has
days.
manifested.
Okay, and then 4 days before the appearance of the rash,
You have flu.
one is contagious. One can actually infect people around him. 4 days after the rash has appeared, one is also still very contagious. Can actually infect people around. When the person sneezes, because it's a virus
Airborne.
that usually reside in our upper respiratory airway, okay, before spreading to other parts of the body. So when the person, an infected person sneezes, coughs, or speaks, just like we are doing now, you releases the droplets.
So when the person leaves the place safe,
And even
somebody
when the
comes
person
in,
has left the room, 2 hours after, an innocent
Somebody
person,
comes in.
yes, before 2 hours, an innocent person stepping into such a room, because as he's going into the droplets, it can fall on surfaces like the table, like the
You
door
can
handles.
mistakenly-
Okay, so someone can actually walk into a room
pick it.
and pick it up. So you can actually not pick. Sometimes when you get to hospitals and we look at them, we say, do you have, we try to do what we refer to as contact tracing. We'll ask the person, did your child come in contact with anybody with similar rash or similar presentation? Oftentimes the answer, they will think, no, we didn't see any. Okay, so in
'Cause the
such cases,
rashes have not
yes,
manifested
even in the
that
US, as we speak now, in the US now, some doctors and other health officials who may have attended to these people that were infected with measles, they were also quarantined. They were also being followed up because of exposure. So usually, even when a child has measles and they want to make an appointment with the doctor, they want the appointment to be beyond the time that you're likely to come in contact with other children.
Okay.
They may want to see you in an office or after the close of work.
We have Adams from FCT.
We have
Adams.
Adams from FCT.
Hello?
Yeah,
morning.
good morning, Adams.
Good morning.
Yeah, good morning.
Please go on.
So how long will a baby suck?
I didn't get that, ma. For how long, what?
Will breastfeed a baby?
The standard time required for normal
Okay,
babies.
Thank you very much. Now in our environment, we have measles as a single vaccine, usually given at the age of 9 months. Okay, it's usually given at the age of 9 months.
Talking about
she's saying
breastfeeding, that how
if
long
you
you
have a
breastfeed
child,
a
what's the
child,
standard
like standard months or
medical
years of
that should be
breastfeeding.
Okay. I didn't get that. Now, talking about breastfeeding, though this is not the topic for today, but we usually advise mothers to do exclusive breastfeeding. Exclusive breastfeeding means giving only breast milk, drugs and multivitamin only, no water, for the first 6 months of life. Okay, but we usually encourage mothers to breastfeed their kids for as long as 1 year and 6 months.
Okay.
Some studies say 1 year and 2 months. So the range should be between 1 year and 2 months to 1 year and 6 months. Thank you for the question.
Yeah.
Okay. Now, also, I was going to talk about the fact that children who are under the age of 9 months shouldn't get vaccinated, and such children are exposed. Now, the only thing they will need to rely upon is the herd immunity in such a population, which will be dependent on the percentage of people that have gotten vaccinated, that have been immunized against the disease. Okay, as we speak now, there are ongoing mass immunization campaign going on in places in Nigeria where we have outbreaks, most especially in the northeast. Usually where you have strife, where you have disturbances, social disturbances and civil disturbances, okay, it brings about converging of people in some certain camps. This is a disease that thrives with contact. Okay, so that is why Borno State, for instance, has the highest number of cases in Nigeria at the moment. And we also know it is largely traceable to the social strife that is ongoing or currently being abated in that part of the country. Okay, so our advice today is that, number one, measles is something that in our community, it has been with us for ages. A number of our parents can actually make the diagnosis, and most of the times they are right, okay, even without conducting any medical laboratory investigation, okay, because specifically, if you look at all the things we are pointing out, and once you see it showing up in any child, you should have a high index of suspicion. Last week, we pointed out that any child you suspect that the person may be having measles, what you need to do is prompt isolation is important. We must take note of that. Prompt isolation of such a child, okay? When you get to hospital, they do the same. I also said last week that measles is a notifiable disease. What that means is that if you suspect anybody has measles, take to the hospital. When the person gets to the hospital knows what to do. They will inform the relevant health government agencies that usually will come around, and then samples will be taken for confirmatory tests and all of that. Okay.
Just sorry, sir. Just asking. As funny as the question may sound, but I want to know: can somebody be a carrier of measles? Like, is in the person's system but did not manifest it? Is it possible?
Yes, not a carrier in that perspective. Not a carrier in that perspective. But what you just said has actually made me to remember something I need to point out. Very important. Now, for people who may have suffered measles and survived, okay, they may eventually manifest again years after some form of neurological problems, symptoms.
How?
You know, when we talked about the complications that can arise when somebody has measles. For instance, both of you rightly pointed out blindness and deafness. People who suffered measles and probably came down with blindness and deafness, that will stay with them for the rest of their lives.
That's true.
Okay, but there are also, in rare cases, you could have some other symptoms showing up, okay? Neurological symptoms affecting the brain, showing up few years after the person must have suffered measles.
Are you kidding me?
Yeah, okay. Now, for an adult who may have suffered measles as a much younger person, the person may have not measles anymore. The person may end up with shingles.
What is
Shingles. What's shingles?
Herpes zoster.
What is it?
It's a form of viral infection that people who have suffered measles are usually prone to much later in life.
Is it similar to measles?
It's not similar to measles. Shingles can be differentiated in the sense that the rash you see in shingles usually will cover an area of the body. Sometimes we could see it covering one part of the face. Okay. And then some other times you could also see it covering just a portion of the skin like this, then getting towards the back. The rash will just be localized only on that place. It's usually very painful. Okay. Gives a lot of discomfort, very painful. Oftentimes it will come down with fever. People who have it will be wondering what type of rash is this. It's not in any other part of my body. It's just located here. Now, people who have suffered measles as children oftentimes could have such presentation in adults. And also, I must also point out that people who are immunosuppressed, who have immunosuppressive illness too, can actually have such shingles showing up in their body. Okay. Now, we want to talk about diagnosis.
Okay.
How is the diagnosis of measles made? Now, oftentimes the diagnosis is made as a result of the presentation that the person is coming in. A doctor examines, takes a good history first, and then examine the patient. He makes his diagnosis. Usually when you make a diagnosis, you could have a provisional diagnosis as a doctor, and then by the time the investigation results are out, you may have a definitive diagnosis. That is when you're sure of the problem you have on your hands. But usually, what we do in terms of diagnosis is if we see a child that has measles in a hospital setting, number one, we notify the relevant health agencies. Okay, if we suspect such children have measles. That's why you hear when we read out the Nigerian data last week, you will hear suspected cases of measles so and so thousands, confirmed cases so and so thousands. So suspected cases are usually different from confirmed cases.
Okay.
Now, samples will be taken for a number of tests that are not usually done in our common laboratories. Are done in.
Sorry, sir, Dr. Barth, let me just cut you just for
Carry on, sir.
epistemological sake to learn now. The question I want to ask here is, you say samples. The lab samples or the lab tests that will be done, we know measles no be blood related. It's more of a flu-like or say na water they go draw for person body. I mean, I see this because I know measles no get to do with blood.
No, thank you very much. That assumption is wrong. Any sickness that affects the human body usually affects everywhere. Okay,
So you can use
yes, the blood samples is actually what is taken for such tests. Sometimes secretions, you're correct. Secretions too can actually be taken for such tests. Okay, so they could do a viral culture. Secretions can be taken, but usually what we send to government agencies when they get to hospitals is the blood sample they will take. So most of the confirmatory tests is usually done by blood sample. They will ask you to take about 5 mils of blood in a special sample bottle, and then you give it to them. You fill the you give the patient's year, age, and some other biodata, and then address and all whatnot, so that they will be able to contact the parents and then follow up to ensure that other children in that vicinity are protected. Okay, they do what we refer to as contact tracing. That is why it is important. Okay, because the essence is to do a prompt isolation of such a child. Withdraw the child from school, withdraw the child from church, mosque, from any form of social gathering until such a child is treated and is certified free before the child can be allowed to go back. Because if you leave the child, what be tied to if that child finds is staying in an environment where you have pockets of unvaccinated children, okay, you can imagine what will happen. Okay, because if you're unvaccinated and you come close to anybody that has measles, 90% of chances are that you pick up the infection because of the contagious nature of this disease. Okay, so talking about the diagnosis, blood sample will be taken, usually sent out. We also do ESR, okay, erythrocyte sedimentation rate, which will give us an idea. Usually if it is elevated, you will start thinking about a chronic illness. ESR has been there for some few weeks to few months, okay? And then you may want to do a chest x-ray depending on what the person is presenting with, because usually they have cough, the type of cough that we describe as hacking cough. Okay, so when you do all this and you have the results in your hand, how do you do treatment?
Hello, Faith.
Faith, good morning.
Good morning.
Good morning.
How you doing?
Fine.
All right, please go on with your question. Can you turn down your TV volume?
Okay.
All right. Go on.
Yes. Good morning, doctor.
Good morning, Faith.
Yeah, thank you for the message.
Yeah, good to have you.
You said in your statement now, you said it's good for somebody to breastfeed a baby for good 6 months with vitamins and drugs, but no water. Can you please explain the reason why you said no water, please?
Thank you very much. Thank you very much. I usually get that question most of the times. Now, newborn babies are usually not given water. The reason is because, number one, the chamber of their stomach is so small. Okay? Now, as a mother, you need to feed a newborn baby as much as 12 to 15 times over a space of 24 hours. So, and their stomach is usually very small, talking about the chamber of the stomach. So when you're in the habit of giving this child water, what you do is that you deprive such a child of nutrients that the child will benefit from, that usually will come from breast milk. So when you give water, the child gets filled, the child will not suck again. When you try to breastfeed, the child will take away its mouth. That's number one. Number two is the fact that the breast milk itself is 99.9% water. So you don't need any extra water. 99.9% water, I said, so you shouldn't need any extra water. At least for the first 6 months of life. Usually after 6 months of life, when a number of people must have started introducing infant formula, and yes, water can come in. Thank you very much for that question.
So you said chest X-ray is required?
Maybe indicated. It's not in all cases, depending. If the child has cough, okay, and then you think the cough will need to be evaluated further, one cannot actually order for chest X-ray. Now, talking about treatment, how is measles treated in a hospital setting? At the moment, oftentimes viral drugs may not be given to treat measles. Much of what we do in terms of treatment is supportive treatment. Okay, usually in measles, the primary infection you have there is of viral origin, but there could be secondary bacterial infection that could join the fray. Okay, in that the child, so part of the medications that usually we give or antibiotics we give is to prevent or to treat secondary bacterial infection where they may be coming in. Okay. Now, other treatment that can be given if the child has diarrhea, which is one of the complications that could arise, you need to put the child on infusions, on fluids to take care of dehydration and then take care of the child's caloric need. That's talking about food requirements. If the child is vomiting and cannot take food, you also need to put on infusion and then give some medications to suppress the vomiting. If the child has if the child is itching as a result of the rash, the widespread rash, you could also give something that could be soothing, something that could be soothing to reduce the itching. Sometimes we'll give drugs like antihistamines, and we also give some balms too that could help to stop itching. Now, talking about prevention. Okay,
I think we are going to actually start from prevention next class. So we'll be saying a very big thank you to our viewers first. But they always make the same time with us, the same day that is every Saturday. Then we thank Dr. Barth. Thank you very much for making it down.
Thank you very much, Chief.
Thank you, sir.
So pleased to be with you today once more.
Thank you so much, Doctor.
Slimmest of them all.
Sir, thank you for coming.
Thank you very much.
Okay, from all of us, we'll be saying a very goodbye to you, but please enjoy your weekend and stay out of trouble. Thank you. Bye.
I'll see you guys 1 to 2 on Top 5. I remember say after the breakfast show, Inina and our children said good day to entertain you guys. So guys, just stay tuned. Got other lovely programs for you guys. Bye.